Good afternoon and welcome to Webinar Wednesday. Today we are joined by Ty Greenhall, Industry Principal, Healthcare at Medigate by Clarity, Emily Holmquist, Senior Staff Product Security Engineer at Illumina, and Skip Sorrells, Director Cybersecurity at Ascension. Webinar Wednesday would like to thank our sponsor, Medigate by Clarity. As the world's most trusted healthcare cybersecurity company, Medigate by Clarity empowers HDOs to comprehensively monitor and manage risk across their healthcare extended Internet of Things environment. Whether it be through a medical device or a building management system, attack services grow as connected assets expand, creating security blind spots that pose risks to availability, integrity, and safety. Clarity tackles these risks to ensure cyber and operational resilience are within your reach. For more information, please visit clarity.com. Just a quick reminder to save the date for our full MD Expo. We're headed to the Caribe Royal Hotel in Orlando, Florida from October the 29th to the 31st. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more details about this, please visit mdexposhow.com. Also, if you'd like to present a class at the Orlando Expo, you'll find information in the handout section of your webinar dashboard. Today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. So let's kick off today's webinar by giving away one of our webinar t-shirts to the attendee that can tell me the answer to the following trivia question. May is National Salad Month. What is the most popular salad dressing in the US? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Ty Greenhall, Emily Holmquist, and Skip Sorrells, and they will be discussing the contractual cure for cybersecurity pain, the power of medical device negotiations. Ty, you may begin whenever you're ready.
Well, thank you very much. It's a pleasure to be here. As always, I can't tell you how many times I was just watching Webinar Wednesdays and learning from them, and so it's a real honor to actually be contributing and presenting. There's so much going on in the medical device cybersecurity world right now, whether it's the FDA or the HHS or the White House, or hospitals or MDMs. I mean, everybody's doing something, right? But I just like to remind everybody, in that is opportunity. There's lots of opportunity as the industry changes and grows and matures. And so, we're typically giving presentations here at Medigate on, how we're the best at discovery of devices using passive tools that do deep packet inspection. As you can see, we're best in class 3 years in a row, and doing vulnerability management and all this wonderful stuff to help reduce risk. But we thought we'd take a kind of a different tack today, and a little bit of product. We support in this area from a procurement and security evaluations perspective, but there are ways to reduce risk before you ever even hook the device up to the network and create a connected medical device. So we're gonna go through a unique document today, and one that I'm sure that you can use, or you can share with your team at your organization. And so, my mother always said, if you're the smartest person in the room, you need to go find another room. And my uncle said that, if you're going to hire somebody, hire people that are smarter than you. So I don't know what that says, what they thought about me, but I know that at least I'm smart enough to make sure I've got the smartest people with me on calls like this. And so today I've got Skip and Emily, who are just both rock stars for this topic and in general. But me, myself, 30 plus years in healthcare technology, doing all sorts of different things. But lately, I guess with Medigate, I find myself as aligning our healthcare vertical with the industry and the needs, and doing some education like this. So really enjoying my time there. And as one of the benefits, I get to have these webinars and calls and discussions with people like Skip and Emily. So Skip, how about if you wouldn't mind giving us tell us about your background and your experience, and so people can understand what, as you're giving your wisdom out, they know that they should believe it.
I think there's some that would argue they probably shouldn't, but that's neither here nor there. So my background started in healthcare with a bachelor's degree in nursing. I actually was an ICU critical care nurse for several years. Truly enjoyed that, but the bug of the .com craze came along, and I was a geek at heart, been on computers since I was in high school. Had an opportunity to take a job with Dell. Moved to Round Rock and went to work in Dell in 1998. Spent many years working for Dell, solutioning for the DoD and the state and local government space. Long story short, I left Dell, went on my own, but when I came back looking for back into an opportunity, I ended up in healthcare supporting Ascension and running their outsourced services. And it just so happened that when that happened, security in healthcare for that organization, for our organization, was really starting to kick off with things like encryption of data at rest. Go figure, 2011. So I worked alongside that security team beginning in 2011, and ultimately that afforded me an opportunity to join the team 5 years ago. And so I'm back in healthcare. I truly enjoy it. It's very challenging. It's also a lot of times feels really cutting edge, because I feel like we're behind the commercial space. As a comparison to, say, the financial industry, we're nowhere close. But that's the cool part. In some cases, the bar is low, and we can see the fruit of our labor very quickly.
Yeah, well, I think Skip, you'd never give yourself an A, and a B+ isn't good enough. So I think you're always driving to excellence. Emily, can you give us a background, your background, and just your background right now, and then we'll talk a little bit about the document.
Yeah, of course. Yeah. Well, first, thanks for having me at Webinar Wednesday. I'm excited to be here. So I'm a product security engineer currently with Illumina. They are a manufacturer of genomic sequencing instruments. Prior to that, I was a product security engineer at Medtronic for just short of 9 years. I've been in the regulated medical device market for over 10 years. I actually started as a software engineer, and that's where I got my craft and introduced into the embedded software development world and learning how to develop products regulated, such as medical devices. And then my focus and area of strength has developed into more of the security risk management as I moved from software development into product security. So I'm passionate about customer interaction between MDMs and HDOs, which is what led me to joining the Model Contracts Task Group. So yeah, I'm a University of Wisconsin alumnus, a Badger. I graduated with a degree in electrical engineering. I live in Minnesota with my husband and 2 kids.
Wonderful, wonderful. We are delighted to have you. And just kind of started off real quick. What negotiations? It's kind of a dirty word sometimes. My company typically takes about 4 months to negotiate this type of contract, and during that time, there's 100% chance that we'll change our minds or discontinue the product. And you can read the last one. So negotiations aren't always the most ideal of situations, but it's a reality that we all have to go through, right? So, with that, there are challenges, and I think just kind of since we really have a great perspective here, we've got both HDO and MDMs, medical device manufacturers and health delivery organizations being represented here. Emily, from your perspective, can you just we've got several here to choose from. You want to talk to us about what your experience has been with respect to challenges in contracting?
Yeah, I mean, this is a great summary, some of the top ones. I think one of the biggest challenges facing MDMs is the ability to commit to specific timelines within contracts in order to release change in response to uncontrolled risks. And so we'll see that in contracts, oftentimes specific call outs to a certain number of days of releasing a patch or responding to the HDO, and that can be a back and forth that lasts for weeks. I've seen it go onwards of months. So medical device development is time consuming. It's, we have obligations to ensure safety and effectiveness of the device. So there's this delicate balance between providing rapid security patches and having to ensure the verification and validation of the product, which takes a lot of time. And so for me, when I see specific dates or timelines called out in a contract, it can be a battle for sure for an MDM to be able to commit to that, because that is a legal contractual obligation that, technically, if you are one day over, then you are void of your contract, and that's a significant risk for an MDM.
Yeah, absolutely. Skip, how about you? What can you speak to the challenges that you face from a healthcare organization?
I think the challenges in some cases are just the opposite of what she described, in that, our legal wants to see stringent boundaries around timeframes and lack the understanding of the actual FDA regulation that stipulates how fast a med device vendor produces a patch and releases it and communicates it. And so some of those challenges are resolved in the form of education, educating others that I have to work with. But I think the common challenge has been, and probably it will continue to be for the next 3 to 5 years as the FDA regulations begin to kick in and manufacturers bolster their security and their ability to patch. But the legacy aspect of it is not the lack of development of patches, for example. So contract or no contract, in a lot of cases, the OEMs aren't validating patches based on the age of the equipment. And that's a challenge for us then, because we've got to seek other measures to compensate for those risks.
Now, so from both your perspectives, the attorneys in this, because it's this is complicated, and the terminology is new. Not all attorneys really understand the language of cybersecurity. Can you all speak to how that introduces a challenge?
Yeah. So attorneys, which are a necessary part of contractual agreements and definitions, they don't always understand the technical nuances or specifics around the clauses or terms within the contract. They're more geared towards I like what you used here, hedging words, in order to, take care of what needs to be done from a business perspective. But that can tend to get in the way of the substance or technically what matters in the context of the clause. And so sifting through that can be a bit of a pain point to get past those hedging words and just get on paper, like, what are we specifically looking at here? How can we simplify this, not make it complicated or confusing, but just plain text what needs to be done here. And so the lack of technical understanding is a definite challenge, I think, for both parties. You know, we both buyer and seller come with attorneys that provide those that contractual background that it is required. But it would just, you know, it would be nice to have a reference or a guidance that can help educate the attorneys on the technical aspects in a simple way, right?
Boy, that sure would be nice. I wonder if we could find a document like that before the hour's out.
That would be great.
That would be great. So Skip, as far as from your perspective, I mean, I would imagine that process leads into the extended duration of trying to get contracts finalized.
Yeah, that's probably the biggest challenge that we have. I can say that I'm fortunate. We're fortunate in the fact that our legal lead for vendor contracts, specifically medical devices, came on very strong 5 years ago and was very well apprised of cyber, surprisingly. She actually really gravitated towards it. So we've had the benefit of her from a legal perspective, understanding the nature of cyber, and quite frankly, seeking out education from us to be educated on the technical things so she could better articulate that in the contract language. So all of the things that Emily just described, I've benefited from. So I can't say we necessarily start from scratch. But I will say when it becomes challenging and the timeline gets drawn out is when there's a debate or battle over whose paper we're going to use for the contract. Now, some would say, what does it matter? Paper's paper. Well, it's the words on the paper that create the conflict. And we have master service agreements that are written in a templated format very intentionally because it includes the basis of the language we've identified that we feel comfortable with entering into an agreement around a medical device manufacturer or vendor. And the challenge that enters into that is when they don't want to use our paper. And we're not easy to work with. I tell all the vendors before we get started, we're probably the worst one in the world you want to work with. Our contract is very laborious. It's very intentional. There's a lot of things you're probably not going to like about it. But if we can pass that and use our paper, it moves very quickly, because then when I'm called upon to consult in negotiation, I know what I should expect in the language, and I can just drill right into that section where there's a red line or a question. When it's on the other party's paper, I have to read the whole thing because it's the context of the whole story that then gets distilled down to a particular paragraph often, right? And so that's where that elongation happens and more debate happens for us. It's over who wrote the contract to begin with.
Yeah, I would also imagine that it's how that language, what your language is, if it's starting on the far side of a negotiated point, where I think that's what a lot of negotiators will say is, ask for everything and then negotiate to the middle. So I would imagine that if your language is more reasonable to start with, you're more apt to have someone accept your paper and the negotiations more quickly, ultimately, time and cost.
That's correct.
Yeah. So what we're going to talk about today is a document put out by the Health Sector Coordinating Council. And so for those of you who don't know what the Health Sector Coordinating Council is, it's a coalition of private sector critical healthcare infrastructure entities that partner and advise government in the identification and mitigation of strategic threats and vulnerabilities facing the sector's ability to deliver services and assets. And within there is a standing cybersecurity working group with over 400 organizations that developed strategies and best practices. So in there was a group that formed to create a document around, how can we make contract negotiations easier? And we started with, and Emily was one of the leads on this group. I was fortunate enough to participate and contribute as I could. But it started out with almost a template from Cleveland Clinic, Froedtert, Kaiser, and Mayo Clinic that had started this effort. And then the group, the document, we refer to it as MC2. And I'm going to let Emily talk a little bit about the document and what it was like when she was leading the group to construct it. So Emily, can you give us a little bit about what that looked like?
Yeah, sure. So MC2 comes from, the name behind it is Model Contract Language for Medtech Cybersecurity. So you have two MCs there. And yeah, so I joined the task group in August of 2020. And as Ty already indicated, it was a joint effort, so exclusively by the health industry practitioners such as providers, medical device manufacturers, which is what I represented at the time, and group purchasing organizations. So it represents the cross-functional collaboration and all parties ultimately having the same end goal to ensure patient safety. So yeah, this collective group of individuals met weekly for almost an entire year, going clause by clause through this framework or this template. And quite honestly, these meetings were a negotiation in themselves. Like there was a clear line between MDM and HDO. And so if you can think of that, like almost an entire 2 years for every single clause, these great industry minds and just decades of experience in this room. It was all virtual actually. And really like getting down to the details and the specifics of every clause that's now represented in this this publication, which was released in March 2022. And addressing several core principles and pillars of cybersecurity and leveraging a plethora of industry standards and guidances and kind of consolidating these into like, what are the basics? What is the framework? And then collectively outlining that in a very accessible and easy to digest, informative manner. So no fluff, no funny business, no confusing words or lingo, just like very straightforward cybersecurity contractual terms.
Awesome, thank you very much. That's a great overview. Yeah, the duration of time on that was amazing, and I think you actually had a child during that process.
I did. Yep. I was saying to you earlier that I had 2 babies in that process. One born in July of 2021, and then model contracts a few months later.
That's hilarious. So yeah, but you stuck with it. You did. So also as a part of this, the group realized that for small, medium, and large, but also everybody's at a different spot, where they're starting out, and so with that kind of a maturity roadmap, if you would, and so that everyone understands that, they might be starting from a different perspective, but have some ability to navigate and where they're going towards. But with that, Skip, can you share with me kind of your journey? I mean, where did you start and to where you are now, and share with others who might just be embarking on trying to get their hands around this process?
Sure. So 5 years ago, I was asked to be part of a contract review, first one ever, and I thought, well, what do you need my help for? We have a whole legal team to do that. And the response was, yeah, but we don't understand some of the stuff they're saying, right? Back to Emily's comment about technical terms and things like that. And so started there, hair on fire, threw me in the deep end right off the bat. And then it became almost commonplace that I was the guy that was going to get a phone call from legal, or maybe one of the resource demand folks that are trying to, get a contract in place and pursue purchasing something. And what was going on behind the scenes, as I mentioned earlier, is the lead for the contract templates was actually very progressive in her thinking and understanding of HIPAA and the regulations around privacy and compliance. And she brought, several people to the table to advise her and how we come up with kind of the basis of the template. Fast forward to where we're at now, and there's been probably 3 or 4 revisions, major revisions to that contract. And, we've gotten to a place now where we have kind of a plug and play model, in the sense that there's the main body of work that doesn't really change. And then there are appendices that get added in or pulled out depending on the presence of a particular element of concern. So an example might be, is the vendor also providing hosting services? What kind of language do we want to have around the protection of our data and PHI? It might be that they outsource some of their personnel to other countries. So we want to be able to capture that. We want to be able to put the requirements in front of them of the activities and actions of those people that are going to function in that contract capacity, providing the product or the service or combination thereof. And then with the ability to take, the MC2 document, which was awesome for me because I'm going off of what I know and I'm thinking we're doing pretty good, and taking that as a measuring stick to our own language and where we're at today, where I'm going back through the MC2 document again and I'm doing a comparison to some of the things that it recommends in our contract to make sure we haven't missed anything. And so I would say that you got to start somewhere. Don't be afraid to start with nothing, but rather than think that you got to create it on your own, lean into the MC2. It's extremely easy to read. It's very, to me, logical. I don't have to be a lawyer to understand it. And it will provide you the basis for getting started, and then also the ability to move through a roadmap of maturity to get to a much mature place down the road.
Yeah, nicely said. The ability to leverage the work where Emily talks about, there was basically almost a 2-year argument over this stuff, that the idea is to share the risk, not have it all on one side or the other, but what can we agree to in the risk reduction? And so that becomes the starting place. And there's going to be alterations and changes and points to negotiate, always, but it's a starting place that's closer to the middle than taking the polarized, this contract is, all is one way, and we're going to have to, propose, it one way on our side, and then we'll meet in the middle. This really is the ability to leverage this type of agreed upon language as a starter place to get this this journey started. And so as we kind of take a look at the model contract language framework, this is how it's laid out. You've got the three main pillars, which are performance and product design maturity and maturity. And then kind of within there, 14 core principles, and then language to support each one of those. As we, if you take a kind of a dive down a little bit deeper there, Emily, do any of these performance pillars or the core principles here stand out as far as noteworthy to you, or did you want to comment on any of these?
Yeah. So these pillars and principles represent that a culmination of several industry standards and best practices. So trying to like summarize that and then categorize and structure it within the MC2. And so they represent in entirety, them together represent and support the security of the entire life cycle of the device. And so I would argue that they are all collectively important together. I think that I would tend to lean towards my area of expertise, which is in the product design maturity, but that in itself is not something that should stand alone on its own. I think that this is all very cyclical and dependent upon one another. The pillar, you can't hold up the device without every pillar of the framework. And so I would say that what's laid out in its entirety is critical. If there's certain particular areas of interest or confusion, it could be beneficial to walk through those specifically.
Well, we've got, within the document, again, part of one of the objectives, obviously, here is to get the viewers to actually, it will provide the link at the end, but to get them to download it and read this, because this is only a snapshot of the amount of data that is provided for, further analysis and understanding. But I really like that comment about, you need all three pillars and, legs of the stool to actually stand up a security program. Skip, I remember we were talking and you had mentioned that, you had incorporated so many of these for the same reasons. I mean, it's really a comprehensive approach.
Yeah, I mean, I think from my perspective, I completely agree. They're all very important. And when you look at a cybersecurity practice, these are the elements of the things that go within that practice through its life cycle. And how do you deal with and address each one? And so, for me, I can't say that any one's more important than the other, because it's situational at best. Depending on the situation, you react differently, and you pull in the appropriate people, resources, and tools to manage the situation. And having references to our own security policy expectations in the contract as a way to demonstrate to the vendor what our expectations are becomes a pretty straightforward but powerful, meaningful way to do so. And it will include these four elements and more.
And as far as can you talk to how this a core set of clauses that we're gonna review a couple of them here, but a core set of these clauses can really help the partnership?
So I think that a couple things. The word partnership for me is a very powerful word. It's the demonstration of a working relationship versus a vendor purchaser or model. And I think it has to be a partnership. It can't be a antagonistic relationship where it's always a constant push-pull argument. So partnership for me is knowing that I can rely on the resources to include the vendor of their own product to represent it in transparency, its shortcomings and strengths, so that I can embrace it and work together with them to provide compensating or mitigating controls, that I have a mechanism to remediate a problem or a mechanism to work through an incident to resolution. And so I think that when you look at the category of customer support, I'd almost change that and say customer relationship and partnership, because it's a two-way street. I don't rely solely on them because they can't provide me everything. They're not in my environment. They're represented within it. And how does that function in my ecosystem? So again, importance of partnership there.
Yeah, I love that. I think that, Skip, what you said is a really important takeaway from the MC2. And I mean, this has been reiterated throughout the discussion so far, is the shared cooperation and the shared responsibility. It's not a finger pointing exercise. It's really saying, how can we together achieve this and or work towards this, and as a partnership. I really like that message.
Well, thank you. That's, for me, that's the only place that it works. It's in those instances that it's not a partnership that it becomes very difficult to make progressive movement. Sorry, Ty.
No. I love it. You're agreeing. You got MDMs and HDOs agreeing here. This is that's the idea. So as we come back to the framework here, just really to transition over to, let's try to think of a way to say, okay, let's pull a few of the clauses out that may be relevant. There's 45 of them in the document, which is, that's a lot, and give you some examples, but then kind of thread them together. I thought, well, there's in the news, Section 3305 of the Omnibus Bill, the Consolidated Appropriations Act, which basically gave the FDA new powers as it relates to medical device manufacturers. It just kind of taken out some of the words there that, we're talking about post-market, also pre-market, obviously. Updates and patches to the device are going to be addressed. Critical vulnerabilities that could cause uncontrolled risks, requiring a software bill of materials. So, those are just kind of a few of the concepts that we might want to further define in our contracting negotiation processes. So as we take a look at one of the clauses, this is clause ID number 44. It's got the title, category of vulnerability management, but under the pillar there, you can see it's supplier maturity, and the core principle is life cycle. So for those of you who don't know what a software bill of materials is, basically it's going to be that the medical device manufacturer needs to provide kind of the contents, the components that are inside the device, so that hospitals can, or end users can, or clients of the MDM can do cybersecurity on the components within the device, not only the device and find out what's vulnerable and risky inside of it. So so kind of with that, for you, Emily, you know, how impactful is the software bill of materials? Are you all talking about it within the MDM world, and does it shape your conversation at all?
If daily is shaping a conversation, then yes, absolutely. I mean, it is completely on our radar and our discussion. I mean, it has been prior to the omnibus bill, but it's now, you know, the US government has raised the bar and really come to this discussion in full force. And so it's a significant impact on MDMs, and it's not as simple and straightforward a solution as one would hope. There's a lot of thought and critical thinking that goes behind it, and you know, the need for effective cybersecurity controls doesn't end with the release of the device. Manufacturers have to demonstrate their ability to monitor the device, address vulnerabilities, and mitigate threats for as long as the device is on the market or the device lifecycle. And so SBOM is one of those avenues for doing so, and just another way to show that MC2 was ahead of its time with this clause 44 identifying that, you know, suppliers have to provide this SBOM. And so the guidance or the direction that's set out here is again a great starting point for manufacturers to address. And then on the handshake, the other side, the HDO has a good understanding of what they should be expecting as well, because again, it is a shared responsibility. Although an MDM will be creating and providing this artifact, the HDO will also have an obligation for managing that in the life cycle of the device within their ecosystem. And so that kind of represents, you know, that shared cooperation for this particular clause.
Totally agree. And yes, hats off. You were ahead of your time and knowing that this would be important. Skip, the and from an HDO's perspective, I mean, this is obviously important and getting more important.
It is. I will honestly admit, though, it's overwhelming. As if we don't have enough to do already, now we're going to have to be able to understand what an SBOM is, how to interpret it, how do we archive it. I mean, you know, the old security monitor, trust but verify. Okay, great, I have an SBOM, but I feel compelled to have to verify it, right?
Mm-hmm.
I don't know if I'm qualified. I'm probably not. I'll just say it. I'm not qualified. I've got a team of DevSecOps folks that do SDLC, software lifecycle development, all day long, all day, and they have their own SBOMs, and they probably would be like, yeah, no big deal. So we're embracing it. We agree it is the right way to go. I think, I haven't asked Emily, but I bet she would admit that there are a lot of arguments in the industry about why you shouldn't provide an SBOM or why you should. And it's, in the end of the day, I think it's irrelevant. More importantly, what value will it bring? And that's really what I'm trying to figure out for our organization is, how do I get value out of it? And I don't know the answer to that yet, for all of the reasons I just mentioned. So we're headed in the right direction. That's the good news. The better news is we'll figure out, we'll grow, and we'll grow into it. So that's kind of where I sit right now. Still very early for me.
Mm-hmm.
And I think that you know, again, so this is a good start here on language that's been agreed upon, and individuals can organizations can build on that. I'll just throw out from a mitigate perspective, you know, we import the MDS2, we, you know, identify all the assets in the ecosystem, and then we're able to attach any MDS2 forms to the actual device data. We're going to be doing the same thing with the SBOM. So just kind of that's very high level, but we will be ingesting the SBOM and attaching it to the assets and being able to then run risk and vulnerability against it. So again, these are things that obviously should be considered in this contracting process. And as you move forward onto some others that still relate back to that original statement or the omnibus section 3305, we're talking here about patches and updates. And so clause number 2, obviously addressing patches and updates. And I'll just let either of you jump in and make any comments, or both. Obviously this may be modified based on the type of device or other conditions. What do y'all think about this particular clause?
Yeah, just to emphasize what you just said as well, that the MC2 is entirely voluntary and tailored to fit. It can be tailored to fit the needs of the contract parties during negotiations. So what's set forth here is what is, we think, the best middle ground for forward looking. But certainly, so the specifics around this clause, there's it speaks back to one of my earlier points about one of the greatest challenges for MDMs is the ability to provide patches in a timely manner, right? Like if we have vulnerable product, affected product in the field, we want to remediate that as quickly as possible, especially for uncontrolled risk. And so again, balancing the need to address urgent matters and the ability to verify and validate those challenges or those changes to ensure that the efficacy and safety remains is a bit of a significant pain point on the MDM. And then as far as for Skip, interested in hearing specifically the maintenance and the routine for applying those patches when they become available is now in the hands of our HDO partner.
Yeah, so that's where the challenge begins, right? It starts with the identification of a vulnerability for us. And then the first next step is, has the OEM validated a patch, right? We've chosen to go that route. It may change in the future, and we may not look to see an OEM validated patch in the sense of, say, Microsoft as an example. We may choose to go ahead and apply the patch before it's validated. Don't take my word for that. We're considering it, but currently our approach is we rely on the OEM to validate the patch so that we are comfortable that it won't affect its expected function in our environment. Then the challenge is, when do we apply the patch? Because we don't use SCCM or some form of agent delivery system to patch these devices. It's the sneaker net, and then is the device in use? Is it functioning in patient care currently, and therefore disruption would disrupt patient care? So there's a lot of planning that goes into, okay, now we have it. How do we get it applied, and in what time frame and window? When's our downtime opportunity? And is there other opportunities, so that when we go to that device, we're not just doing one thing, we're doing the preventative maintenance if it's time for it, if it's due. Are there other patches that can be combined? So that mindset of the Microsoft roll up many patches into one, we apply to the roll-up of one touch equals many things in our environment, so that we're hoping to be more efficient and less disruptive. But that's the challenge of the med device patching, how and when to get it done once it is available.
Yeah, scaling is definitely one of the challenges in all this. And from a time perspective, I'm going to just kind of throw this one up there. We won't have to talk about it much, but anybody pull down the document, look at clause number 32. But again, going to vulnerability management, talking about security patches, and then again, another post-market guidance, pre-market guidance, as the FDA actually moves from a draft into a final guidance. We'll see more specifics on what's required, but I would say that the pre-market and post-market documents are probably pretty close. But it's just important to note that in this new legislation that there are prohibited acts, and you don't, as a medical device manufacturer, you don't want to violate that, because now this is really the teeth that have been finally given to the FDA here, which is criminal prosecution, civil penalties, injunctions, and whatnot. So, this has become serious, and not that it wasn't always, but the FDA's no longer really guidance the way it used to be, and that from a HDO's perspective, trying to make sure that that's covered, be a good place to start right here. And then with the just thinking, procurement and security evaluation, Medigate works in this area. One of the things that we offer is the ability to compare devices. We have the device, we look at it, we figure out what the vulnerabilities and the risks are. What if you were to put in certain controls that you could reduce that risk, bring down the network risk or the severity or the device vulnerability, and so you can get an idea of, should I bring on a new device? Should I not bring on a new device? But again, I think that that's just kind of another option. In the MC2 document brings to the same procurement and security evaluation to reduce risk on the front end by I guess transfer. You're not assuming the risk. You're making sure that you're not taking on all of the risk in the contract. You're defining that. And so again, Skip, can you kind of talk to how you manage kind of use the MC2 in the procurement and security evaluation process?
Sure. I think all of the pillars that live within it become kind of the measuring stick, if you will, of the contract language, and in the sense of simple gap analysis. Do we have language that covers or defines the expectations around patch notification, patch delivery, support mechanism? So does the vendor provide a level of support that includes the patching? Some do, some don't. So having an awareness of that, so that if it's not performed by the vendor, then we have the opportunity to ask for additional support from the vendor or seek support through another mechanism, as one example. But I think in general, the way I'd phrase it is, for me, the use of the contract model language guideline serves as that measuring stick, a way to assess what's in a contract or what's not in a contract, and provide an opportunity to say, what about this? I don't think we've covered this well, or could we borrow from this document as the basis of a starting point to get to the final document that we agreed to?
Yeah, and summarizing all of this, again, is sharing the risk, kind of the whole idea, reducing cost and timelines. We started out talking about that. Better risk assessments. Skip, you were just talking about how you're using the document to help drive your assessments, and then what's missing, drive it down into the documentation and the contracts, highlighting and helping to outline and bring forward things that are risk or at risk. But one of the interesting things, Emily, you talked about, I love the idea, was basically, when working backwards. Do you remember talking about that? Can you share that idea with us?
Yeah, it was something I was just playing around in my head with one day, and this is speaking more towards MDMs or organizations with a less mature product security programs. And so I believe that the MC2 could be leveraged to work backwards, and by that I mean looking at whether it's the 45 clauses or the 14 principles, and shifting that, or I guess that's shifting it for you guys this way, left, all the way back to the design and development of the products. And so creating these as product design controls. So what is ultimately becomes a contract term is a design input. So if you are lacking in your organization the resources of how do I design, or what do I need to do, you can use this as a reference or a guideline to say, hey, here's a roadmap of the design inputs that I need to design and develop a secure product that ultimately is going to be such an easy process when it gets to skip, and it's just check, check, check. Everything's been designed into the product, which are design controls being our highest level of assurance in the security of the device.
Well, that's just like out of the box thinking. And so you can see why I brought these two individuals on the call. They're, just full of great ideas and knowledge, and both utilizing this tool in different ways to support, their own organizations. Thrown up here, I know a lot of security people don't like QR codes because you don't know where you're going. However, the one on the left is going to take you to the model contract language document, and then the one on the right will take you to the, who is the Health Sector Coordinating Council. We have a lot of other great publications there as well. I would suggest HICMALTS, HICMALTS, which is basically for legacy technology, how to cyber secure legacy technology. That's on that website. But leave those up there for just a second. And for those of you who want a, not comfortable, there's my email address, tygg@clarity.com. And you can email me. I'm happy to send you a copy of the presentation where you can use there's a hyperlink there, and you can use that instead of the QR code if you're more comfortable there. But happy to get you a copy of the presentation also. And kind of with that, we've just got a couple minutes left. I don't know if there's any questions, or if there's not any questions, would love to just make sure that Skip, Emily, you didn't, if it was something you wanted to say, but we didn't.
We are coming up to our hour, but if Emily or Skip just want to briefly say anything more, that would be fine.
Don't be afraid. Start somewhere. You will succeed.
Perfect.
That's great.
Okie dokie. Well, oh, sorry, you go ahead, Ty.
No, I was just going to say, again, thank you. And thank you very much for allowing us to be here today. We love Webinar Wednesdays. And if any questions or want the PowerPoint presentation, just feel free to reach out to me, and go ahead and download that document. And a nice, easy read. Really forward it on to your legal department, your procurement department, your risk department. Share that document. It'd be a great way to reduce your risk, without really much or any expense.
Perfect. Thank you so much, Ty, Emily and Skip, for your time today and for a really great and informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide for our industry. So please visit clarity.com for more information. As promised, the answer to today's trivia question is ranch dressing. So congratulations to our winner, Martin O'Brien. A quick reminder, you can obtain your certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back soon with another webinar, so please visit webinarwednesday.live for more details and, of course, complimentary registration. Thanks again for your time today, and we hope you have a great Memorial Day weekend.
Thank you.
Thank you.